Hey guys, today I want to talk about the 5 rights of delegation with nursing. Let's get started. Okay, so the first right that I'm going to talk about is the right task. So with the right task, we need to know who we're delegating to and who can do the task. You need to make sure that you're familiar with your Nurses Practice Act, because when you're dealing with this task, you need to realize that everybody has a certain scope that they're allowed to practice under. Okay, so with the next right, it's the right circumstance. So with the right circumstance, this begins with assessing of your patient. You need to delegate to one of the nurses on the unit that is going to be familiar with what our patient's needs are. So just for instance, if you had a nurse come to your floor that usually don't work there, she was just pulled, yet you had a patient that is critical. I don't think that we're going to want to delegate this patient's care to this nurse that's been pulled, because it's not the right circumstance. They're not used to this type of nursing. All right, so the next right is the right person. All right, so with this, we need to make sure that we're picking the right one for the job. We need to see if the person is knowledgeable, if they have the skill. So you can have one RN that just came out of nursing school, and then you can have another nurse that's been working on the unit for about 10 years. So if we're going to delegate, we can most certainly delegate it to the person that's been on the unit longer and maybe have them proctor the new nurse. That way we can be teaching skills that this new nurse doesn't know yet, and then she can feel confident that the next time that this skill needs to be delegated to somebody, that maybe the new nurse will be able to participate. Okay, so the next one that we're going to talk about is the right communication. So when we're talking about the right communication, um, we want to make sure that when we're speaking to our staff, whether it's our aide or an LPN or even other RNs on the floor, we want to make sure that we're letting them know exactly what we're expecting. So we need to make sure that we give them a time frame, what tasks need to be done, and what we want them to do is we want them to come back to us and make sure that they're feeling comfortable with everything that we're asking them to do. Communication is a very big thing with nursing, because if we don't communicate, we can miss something that can be very important when it comes to our patients' care. Okay, and the last right that I want to talk about is the right supervision. So, yes, we do delegate to other staff members what we need them to do, but ultimately, at the end of the day, when you're getting ready to leave and do your paperwork, you need to make sure that the things that you delegated have been completed, because it's your responsibility. You need to follow up, make sure that whoever has completed the tasks come back to you, and they give you feedback on what they did. That way you can see if it's been done correctly, or if it was something like a dressing change or changing of a IV medication. You might want to go into the room and, just check it for yourself. Talk to the patient, see how they're doing, and that way you can just make sure that everything's been completed the way that you would complete it, or the way that you want it to be completed. All right, well, that is my interpretation of the 5 rights, and I hope that it was a little bit of knowledge for you, and I hope you enjoyed. Thank you.